Welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us on the program today. Recently, the Centers for Disease Control announced a study that the results showed an increase by 24% over the past 15 years in suicides. Now, the most dramatic increase was seen among girls aged, now get this, aged 10 to 14. Now, since 1999, the suicide rate for this particular group has exploded by more than 200%. Our guest in studio today is Dr. James Greenblatt, a Boston-based psychiatrist and pioneer in integrative medicine, and he says that the factors contributing to this disturbing trend among girls include malnutrition, antidepressant use, and higher rates of depression. He's here to talk about his brand new book, Breakthrough Depression Solution, Mastering Your Mood with Nutrition, Diet, and Supplementation. Good afternoon, Dr. Greenblatt. Welcome to the program.
Thank you very much. I'm glad we're here to talk about such an important issue.
The suicide rate among girls aged 10 to 14, I mean, the suicide rate increasing at all among any age group is tragic enough, let alone our young girls aged 10 to 14. What could possibly be contributing to a 10 to 14-year-old girl wanting to commit suicide?
It's frightening statistics, but it's really powerful, and I do think there's a combination of factors that we do understand, and we need to make sure that both parents and professionals are aware of. The 25% increase overall was dramatic, and it's not just in this country, it's globally, and the statistics are one suicide every 40 seconds globally. It's a very frightening thought. Man. But this increase in 10 to 14-year-old girls, when I was in training in psychiatry 25 years ago as a child psychiatrist, we would say that, that under 15-year-old kids aren't capable of making that decision to kill themselves, and now we're seeing it all the time. And I think it's the combination of factors you mentioned. The antidepressants, the medicines that we're using to treat depression actually have what's called a black box warning. The FDA is telling physicians that it can cause increase in suicidal ideation. And then what this book was written about is malnutrition and how a malnourished brain can contribute to suicidal thoughts. And then the kind of what we call the gasoline on the fire is the social media, the access to these very powerful support groups for suicide, this very powerful bullying, cyberbullying, all contributing to these suicide rates increasing.
I was under the impression that depression is a disorder of the brain. Now you're telling me that the brain is being affected by what's going on, as far as what we're eating. Is eating causing depression? Is what's happening there? I thought that the brain was the culprit.
Well, I think we can say, the brain, which controls our thoughts, feelings, and behaviors. But if the brain is not nourished, and I've seen this working in the field of eating disorders for 20 years, and these malnourished girls, young girls, we're seeing them as young as 8, but often between 10 and 15, as they restrict their food intake, we've known for many years that patients with anorexia nervosa have the highest risk of suicide of any psychiatric illness. And that is due to many factors, but one of the things I firmly believe it is due to the kind of this malnourished brain. The research is most clear on the fat content. The essential fatty acids, EPA and DHA found in fish oil, is directly associated with increased suicidal attempts and behavior. And we've seen this in our anorexic patients, and it's also been studied in our veterans, where suicide is a major problem.
Medication alone versus medication in combination with improved nutrition versus improved nutrition alone. What are the numbers when it comes to effectiveness in the percentage of patients that you see or that you study from other facilities or other practices?
Well, I mean, the sad news is there are research on antidepressants, which was kept quiet for many years by the pharmaceutical companies, has demonstrated that the response to our medications are barely around 50%. For severe depression, it can kind of inch up to perhaps 60% or more, but around 50%. And our response rate to placebo, meaning a sugar pill, if you will, is almost as much as 40% in depression. So our medicines have not been as effective as we would have liked. Mm-hmm. We don't have good research on the effectiveness of nutrition by itself, but in my practice over 25 years now, I share with patients and families that if I can use both medicines and nutrition, I believe we have a much higher probability of not doing the trial and error guesswork of medications, but really treating a depression.
You've developed a specific treatment plan to deal with depression. Talk about this treatment plan. Is it mentioned in your book?
Yes, part of how I try to help patients and other professionals kind of understand the somewhat complicated way of looking at nutrition and depression is a mnemonic called the ZEEBrA approach. And I chose the mnemonic zebra, or the metaphor zebra, because every zebra has a different stripe pattern. And I think that's a really powerful image when we think about treating depression. As we've discussed, depression is not a Prozac deficiency, and everyone's different. So the zebra stripe patterns being unique is that we need to look carefully. And then the mnemonic just kind of lists the kinds of things you need to look at. So the ZEEBrA approach, we go through things like sleep, and H is for hormones, E is for excluding foods, checking for celiac disease, Z is for zinc and other minerals, and then two more E's for exercise, essential fatty acids, and the B vitamin, and then restoring the gut, and then amino acids. So we go through systematically each of the kind of major nutritional metabolic influences that might affect depression.
Does this treatment work more effectively in younger people than in older people, or does it depend on the level of depression that you're diagnosed with?
No, I think all ages. I mean, with the last section of the book, I emphasize the importance of utilizing this approach in both our elderly and our adolescents, because often those are the most responsive to nutritional interventions. But really, anyone with depression should have their vitamin D level checked, because vitamin D can contribute. Should have vitamin B12 levels checked. It doesn't mean everybody with depression is deficient, but if you are, it provides a solid foundation for both the therapy that is often needed, medications might be needed, but certainly improvement in symptoms.
Is nourishing, as you said, the brain, is it the same as nourishing the mind, or is there a difference when it comes to this this ZEEBrA approach that you talk about?
Well, I use the ZEEBrA approach for that kind of nourishing the brain, giving us the big picture of how nutrients affect depression. And then, I turn to what I describe as nurturing the mind, those other techniques that have profound effects, unrelated to nutrition. And those are the psychotherapies, but also things like spirituality. And people often forget that faith and spirituality has important implications for the treatment of depression. We know that those that have a strong faith, it doesn't have to be an organized religion, they are a lower incidence of depression, and what's interesting, they respond better to antidepressants. And we also look at mindfulness and yoga practices that all support a more comprehensive integrative treatment approach.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us on the program today. Our guest has been Dr. James Greenblatt, founder of Integrative Medicine for Mental Health and currently serving as the Chief Medical Officer and Vice President of Medical Services at Walden Behavioral Care in Waltham, Massachusetts. He's been here talking about his book, Breakthrough Depression Solution, Mastering Your Mood with Nutrition, Diet, and Supplementation, and also about his ZEEBrA technique involving nutrition that he has developed in order to treat depression without medications, but simply by improving one's nutritional intake. It's been a pleasure speaking with you, Dr. Greenblatt.
Thank you very much for having me.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.